You know how terrible norovirus is? There's this other thing that can happen a couple weeks later I want you to be aware of. I had a school-age kiddo come in last week, and he'd been having stomach issues for an entire month. Told Dad to walk me through. He said the entire family had a stomach bug around New Year's. Lots of vomiting, lots of diarrhea, lasted 2 or 3 days, seemed to get better. They didn't need to go to the hospital or anything. Then he had a week that he seemed pretty good, and then he was like having some issues with constipation, having a hard time passing bowel movements, and then he seemed okay after that. And then this week, he's been having issues with diarrhea again, and he's been having like 1 to 2 like loose to soft stools. He's been having some accidents where this is a school-age kiddo. He's old enough. He shouldn't be having accidents anymore. And then today, patients started to complain of some difficulty peeing, and no fevers, eating and drinking well. And again, this is an otherwise healthy kiddo. His vital signs are stable. On physical exam, heart and lungs are fine. His belly, I can feel some stool on the left side, kind of like hard bouldery kind of poops. Let's start with some easy stuff. Let's get an abdominal x-ray. I have some suspicions for constipation. Even though we're saying diarrhea, it looks like we are constipated. And let's check a urine. Abdominal x-ray shows substantial stool burden, so he's constipated. Urinalysis is perfect. No white cells, no red cells, or anything like that. This kiddo had probably an acute viral gastroenteritis, probably norovirus, then developed constipation, and now is having something called onchopresis, where the hard boulder stool sits in place and the soft stool moves around it rather than pushing it through. And that's why he's having accidents, because he actually doesn't feel the soft stool moving past the hard stool. This is a pretty common story following a stomach bug like norovirus or another gastroenteritis. It affects the GI motility for sometimes a couple weeks after. You're also eating a lot of that like brat diet, low fiber, high carbohydrate that doesn't move through very well. You're throwing off the GI flora, and you're also getting a little bit dehydrated and sometimes getting nervous about having a bowel movement because you've been traumatized by the norovirus. Treatment for this kiddo is to do an enema in the emergency department to get a lot of that hard stool out, and then do a GI clean out at home, and then to resume a high fiber diet and follow up with his pediatrician. When you have a GI bug, it's important to try to resume your normal diet as soon as possible to help that GI intestine heal, and also to continue getting the fiber that you need to keep the poop on pooping. And the urinary complaints were secondary to the constipation. This is common, especially in boys, but can happen to girls too when constipation is getting pretty bad. PTSD from the norovirus keeps PTSDing.